Good evening. This is Lisa Whitty Bradley with chickswithmds.com. I'm just going to introduce myself while Facebook is sending out the message that I'm live. So I am the CEO and founder of Chicks with MDs, which is a professional think tank that focuses on educating not only patients but providers, specifically physicians, about changes in healthcare and information that is not widely known and accessible. So right now I'm really focusing on the Affordable Care Act and the changes that are going on with the new Trump administration, and just making sure that folks know what their rights are under the current laws. I know there's been some voting going on in the Senate and the House. It was coming up soon about rolling back the coverage under the Affordable Care Act. But for right now, the only thing that has been voted on are budget restrictions to the current law. The law itself has not been manipulated at all because the current administration doesn't really have a solid or effective plan to replace it. So for now, I'm just going to do a short post tonight about what your current coverage options in terms of preventative care are under the law, and also some critical websites and resources for you to have. And also, I want to talk about the current enrollment period that just ended on January 31st. So the enrollment period under the Affordable Care Act under healthcare.gov was created so that there are periods during the year when you can go in and, number one, obtain health care coverage, or so a health insurance policy, or make changes to your existing policy. So number one, the website to go to for that is healthcare.gov. And the reason why I'm addressing that this week is because they have the numbers back after the close of the open enrollment, which ended January 31st. And unfortunately, the numbers of people enrolling were significantly less than last year's numbers. And part of that decrease in numbers is thought to be secondary to the rollback of advertisements associated with this open enrollment period that has occurred under the new administration. So the new administration rolled back these advertisements, and the number of enrollees went down by the millions. So for right now, you just need to know that the Affordable Care Act and the rights you have under the Affordable Care Act are still in effect. The next open enrollment period is November 1st of 2017, and then that will go likely until January 31st of 2018. Once you obtain new coverage within that new open enrollment period, the coverage will start January 1st of 2018. The other thing is there are certain exceptions to the closure of the open enrollment period. So right now, if you're just like randomly, you decide now you want to change the coverage that you have, that you got through healthcare.gov, or even through a private insurer or through your employer, likely the open enrollment period for all of those entities has closed. However, the exceptions are, number one, if you become pregnant, that's an exception. Also, if you become unemployed and you lose your insurance, you should have access to get a new policy or COBRA or whatever you're looking for under the healthcare.gov, so that you can get subsidized health care coverage. And then the last one is that if you're applying for Medicaid, or if you're applying for the Children's Health Insurance Program, which is Medicaid for children, then there's no restriction. You can apply for Medicaid or the Children's Health Insurance Program anytime during the year. There are no restrictions. The other thing I wanted to talk about are what your preventive care coverage includes under the Affordable Care Act. And this is an extensive list, but I want to go through it because I really want you guys to know what your rights are and what's going to be voted on in the two houses in the coming weeks. So number one, alcohol misuse or screening and counseling, aspirin use, blood pressure management and screening, mammograms, cholesterol, colonoscopies for colorectal cancer, depression screening for adults, type 2 diabetes, your diet in terms of obesity or any diet or weight imbalance as a result of any chronic illnesses, HIV screening, and also sexually transmitted disease screening across the board, immunizations. Let's see, what else do we have on here? It's extensive. Tobacco use, syphilis, which is also a sexually transmitted disease, anemia, the breast cancer chemo prevention counseling for women. So there are some women that are in a higher risk group, whether they've had breast cancer themselves or they have a family history, or sometimes as a child you can have chest wall irradiation for childhood cancers like lymphoma, and that puts you at a higher risk for breast cancer later on in age. So they talk to you about chemo prevention in that regard. Breastfeeding is also covered under preventative care. Contraception, cervical cancer screening, hepatitis B screening. Also, there's something called abdominal aortic aneurysm, so the major blood vessel that takes blood from your heart to all of your organs. Sometimes in the abdominal component of that blood vessel can dilate and stretch, and sometimes it can rupture. So there is screening for this, which is more common in men, but the screening study is covered under the preventive care aspects of the Affordable Care Act. So that's something else. HPV screening for women. So HPV is the most common cause of cervical cancer. So that's covered. And autism screening, diseases of the thyroid, depression, hearing screening. I mean, the list goes on and on. Iron and lead abnormalities, and then vision screening for all children. So these are all covered under the Affordable Care Act, and it's just important that we make sure we take advantage of these screening studies and this coverage while it is available and covered under our current insurance policies. So the last thing I wanted to talk about were major websites that I think you guys all should know. So the first is Centers for Medicare and Medicaid Services, that's cms.gov. And you can subscribe to this website. If you are covered under Medicare or Medicaid, you really should subscribe to this site. I would it'll give you options for getting updates on your email, and I would try once a week. Sometimes if it's daily, it gets a little overwhelming, but they can give you news blasts and updates about any changes in Medicare and Medicaid coverage, and also with the Children's Health Insurance Program. Another good website to have is Medicare.gov. That's specifically for Medicare coverage. Also, you want to follow, if you have health care under the Affordable Care Act through the healthcare exchanges, or if you want information about those websites, about that insurance coverage, there is Obamacare-plans.com. That's OBAMACARE-PLANS.com. And then also for health coverage, if you want information about insurance under the healthcare exchanges, that's healthcare.gov. So if you have questions, if you watch this on the replay and you have any questions, feel free to leave them in the comments. You can also send me a message through Chicks with MDs on Facebook, or follow on Instagram and Twitter, and feel free to leave a message there. In 2 weeks, we're going to probably get back on track with reviewing the outline from the ebook that we released in December, which is implement the essentials of implementing the next wave of healthcare reform, and it's basically for healthcare providers and how they can make sure they know how to navigate the next wave of healthcare reform, which is the quality payment program, which started on January 1st, 2017. So when I get back in 2 weeks, we'll start on that. Until then, take care of yourselves, always be educated, informed, and take care. See you soon.